can. We're going to start with this extra large heart here. The things that I ask on the outside front are going to be anything in blue is called a coronary vein, and anything red is called a coronary artery. So I'm not going to ask you to know the specific ones, but if I point to a blue vessel on the front, coronary vein, red coronary artery. Okay? A couple of other things here. These are called atria or auricles, but on the outside, they're normally called auricles, which is another name for ear. It looks like kind of like a dog's ear that's been flapped down. So because I'm standing behind this patient or this heart, right is right for me and left is left. But since you are facing this person or this heart, everything's going to be reversed. So right side, left side. So one of the things that you will need to know is right versus left. And remember, it's always reversed if you're facing the object or person. So this is a person with a heart in them. And so this is my right, your left, my left, your right. So left side, right side. So this would be the right auricle, left auricle. Okay? So let's go into some of these blood vessels. The nice thing about this heart is the blood vessels come off showing the semilunar valves nicely. So we're going to do that. Blue here is called the pulmonary trunk. Pulmonary trunk. And this is actually an artery, a type of artery. Now, why is it shown in blue? Well, one of the things you guys need to know from all of these models is that if it says anything pulmonary, the colors are going to be reversed. And the question is, why is that? Why is that? Because the pulmonary system, which is the blood going to your lungs and back, does the opposite job of everything else, all the other blood vessels. Now, if you think about a normal artery, right, that takes oxygenated blood out to the tissues and returns deoxygenated blood through the veins, right? That's every other vessel. But in the pulmonary system, it's kind of recharging the blood, so it's doing the opposite. It's taking deoxygenated blood, blue, sending it out to the lungs where it's getting oxygenated, coming back to the heart, red. But arteries are always sending blood away from the heart, and veins are always towards the heart. So in this case, you're going to see the colors reversed. So anything pulmonary is going to be blue, which means deoxygenated. Now, a little side note, the blood really never is actually blue. It's only coated that. It's a darker kind of a purpley red color in the deoxygenated side. And then whenever you see it coming out of a person, it's always bright red because it's oxygenated, right? So if you see venous blood going into a vacutainer, usually it's going to be kind of a dark purpley red brick color. And then if you see it coming out of an artery, it's going to be a bright red. So it changes color slightly, but is never blue. Does that make sense? They're only coded blue to tell you deoxygenated blood. All right? So pulmonary trunk, pulmonary arteries, blue. Okay, so anything on the sides here, pulmonary arteries, pulmonary trunk. Okay, so let's go around the back side. Actually, let's take this off and see if we can see some other things. Now, if I turn it this way, you'll see the two semilunar valves, pulmonary in blue and aortic in red. So this would be pulmonary semilunar valve, aortic semilunar valve. Aorta has oxygenated blood in it, so that's the aortic semilunar. Now, if we put this back on here, another vessel you're going to see before I turn it around is called the aortic arch. Okay, this whole thing is the aorta, but the aortic arch is the area just above the heart. Anything going back behind the heart or below it is called the descending aorta. Then when it gets to the abdominal cavity, it becomes the abdominal aorta, and then that's it, and it splits into the arteries that go into the legs. Does that make sense? Aortic arch here, descending aorta all the way down through the thoracic cavity. And then when it gets to the abdominal cavity, it's the abdominal aorta. Does that make sense? And then these vessels here, I usually don't ask these vessels on this heart because it's a little bit wonky and not very clear. Okay, but I will be asking other blood vessels, especially where you have a QR code that keys it. Okay, so let's go to the back of the heart. I'm going to move this here. Oh, one other thing that you should see, this light blue thing here, right in between the pulmonary trunk and the aortic arch is called the ligamentum arteriosum. Now, what is it? It's a remnant of a vessel that transferred blood from the right side to the left side. Now, why is that the case? Because when you were inside your mother's uterus, there was no need for lungs. And the question is, why didn't you need lungs when you were inside your mother's uterus? I mean, you had them, but you weren't using them. Why? Because mom was giving you the oxygen. Why did she have to? Because there's no air in the placenta, right? So the blood was bypassing the lungs. One of the ways it did that was through what is called the ductus arteriosus, and then when you're born, it degenerates into what is called the ligamentum arteriosum. So when you see it in an adult, it's the ligamentum arteriosum, and in a fetus before birth, it's called the ductus arteriosus, okay? So that's the front. That's pretty much everything on the front. Now everything on the back, you guys see these red vessels here? If this is pulmonary, what would they be if they're red? Artery or vein? Vein, right? Because remember, pulmonary, the colors are reversed. Arteries normally red, veins normally blue, right? But since it's pulmonary, it's going to be reversed. Pulmonary veins, bringing oxygenated blood back from the lungs to the left ventricle. Okay, so that's all the outside, front and back. The only other thing I haven't given you are these large vessels here, above and below. This one here is called the superior vena cava. Vena meaning as in Venus or Venus. Cava meaning large and cavernous. Okay, so superior vena cava is draining all the deoxygenated blood from the shoulders and head to the right side of the right atrium. And then down here, everything below the heart is called the inferior vena cava, bringing deoxygenated blood up from the lower part of the body. Okay, so I believe that's everything on the outside. So let's go to the inside here. Okay, inside, still right side, your left, left side, your right. Okay, notice on this side, the wall is thinner. Now, one of the questions that's asked on the lecture is, one of the best ways to tell left from right is from the divider in the middle. The answer is no, you can't, because it's in common between both sides, right? You have to look at the lateral walls to tell the difference. Now, you may see thinner on the right, thicker on the left, because the right side is pumping only to the lungs and back, which is a much smaller job than pumping out to the whole body. So the left side is going to have much thicker myocardium or wall thickness. The right side much thinner because it's only pumping to the lungs and back. Does that make sense? That's one of the ways that you can tell. So this is called the right ventricle. This valve here, this rubbery valve here, is called the tricuspid valve. Now, how do you remember that? Well, right starts with the letter R. And what letter is in the word tricuspid? R. So R and R, right? Right and tricuspid. It's called the tricuspid because it has three cusps, and I think in this model it very clearly does have three like little triangular points or cusps, okay? So tricuspid is on the right, and what it does is it makes sure that blood doesn't go from the ventricle back into the atrium as the blood is being pumped up and out through the pulmonary trunk out to the lungs, okay? Does that make sense? Now the little folds and wrinkles that you see in here are called trabeculae carneae. Trabeculae mean kind of threads, and carneae mean meaty, so they're kind of like meaty threads. So anything that looks kind of like folds or wrinkles in the walls of the ventricles are called trabeculae carneae. Now, going back to the tricuspid valve, these strings are called cordae tendineae. So it means tendinous cords. And what they do is they anchor these muscles here, which are called papillary muscles. So there's another thing. If you see a muscle sticking up, now I don't know if you guys remember dermal papilla, where little structures look like fingers coming up through the dermis into the epidermis. These are called the dermal papilla. I'm sorry, still back in the skin. These are called papillary muscles, right? Mm-hmm. Is that what I said? Mm-hmm. Papillary muscles. Okay, papillary muscles, and what they do is they pull on the cordae tendineae and make sure that the valves don't evert or flop the wrong way. And they work kind of like someone pulling on a parachute cord so that the parachute doesn't flop the wrong way. Now, normally the weight of the parachuter does that job, but because there's no weight inside your heart, these papillary muscles pull on the strings. So when the blood pushes up against the tricuspid valve, this tricuspid valve is soft. So you don't want it flopping the wrong way and letting blood go the wrong way. That would be a heart murmur. You guys have probably heard of a heart murmur when blood goes the wrong way. Okay, so papillary muscles, cordae tendineae, tricuspid valve. And then the trabeculae carneae are all the folds and wrinkles. Okay, so then the blood's going to go up and out through the pulmonary trunk, pulmonary arteries, lungs, back through the pulmonary veins, right? And then back over here. You guys see the pulmonary veins here I showed you before, right? So this is bring oxygenated blood to the left side of the heart. So this would be left atrium. Now, I told you auricle is normally the name for the outside when it's pointed to on the outside because it looks kind of like a dog's ear. But atrium is whenever it's on the inside. Okay, so auricle on the outside, atrium on the inside. They're somewhat interchangeable, but that's what I'm going to be asking for you guys to know. Okay, so over here was right atrium, left atrium. This is receiving deoxygenated blood from the inferior vena cava and the superior vena cava, down to the right ventricle, out to the lungs, back from the lungs here to the left ventricle, left atrium, then down through the bicuspid valve. Now this is different because it only has two cusps or triangles as opposed to this. So what letter would you not find in the word left?
R.
R. And what word would you not find in the word bicuspid? R. Right? So R goes with right and tricuspid and left and bicuspid, okay? Since they don't have any R in it, all right? It's also, the word that you might hear, especially in the lecture, is LAMB, L-A-M-B, left atrioventricular mitral, or bicuspid, L-A-M-B. So it's the mitral valve. You might have heard of mitral valve prolapse. Mitral valve prolapse can lead to the most common cause of a heart murmur. Okay, mitral valve prolapse. Okay, so bicuspid valve, more of the papillary muscles, more of the trabeculae carneae, and then up and out through the aorta. All right, and I believe that's about it. This little indentation here, I know it's kind of hard to see. It's called the fossa ovalis. It's just a little indentation right in between the two atria. Now, what that is remember I told you that this structure, that little ligamentum, is the remnant of a tube that carried blood away from the lungs of the baby to the left side to be pumped out to the umbilical cord and out to the placenta, right? So the other job, the other part of that is to send blood from the right atrium over to the left atrium, and then functionally all the blood leaving the heart is going out through the left side and eventually down through the umbilicus and out to the placenta. You don't want anything going on the right side because that's to the lungs, and the lungs don't work when you're a fetus, right? So this is another bypass. This is the remnants. So the foramen ovale, you guys remember that foramen ovale in the skull? Same thing in the heart, foramen ovale, and becomes the fossa ovalis. So when you're an adult, it closes. You guys ever heard of blue baby? Mm-hmm. Blue baby happens when one of those two things doesn't close up quickly during delivery. So if it doesn't close up, it means the left and right sides are still connected and you're not separating oxygenated from deoxygenated. In the fetus, there is no separation between oxygenated and deoxygenated, but they don't need as much oxygen as newborns and adults do. Okay, so I think that is it for all of this heart. Now, you guys have this model, right, already set up? Yes. Now, because we are on blood vessels, all of the blood vessels are going to be available on this one as well. So I may, on one of these stations, have just the blood vessels pointed out here. Okay, so since you have it as a QR code and you have it as a model, also you guys need to learn the blood vessels. All right, so that's in there. Okay, moving on to the torso. Now, just for blood vessels, we're going to have these torsos going to come up in our next two tests because we're going to be looking at lots of different things. But fundamentally, we have the superior vena cava, and then we have over here the brachiocephalic. Now, why is it called brachiocephalic? Because brachio means arm and cephalic means head. So it's the structure that gives blood or is draining blood from both the head and the arm. Okay, so brachiocephalic on both sides. And when you get up into the neck, that's going to be jugular. Now, you guys have seen in movies where someone says the jugular was cut, right? And blood was spurting everywhere. Well, that's not really accurate because which side of your circulatory system has more pressure, the venous side or the arterial side? Arterial side. So if you really want to see blood spurt out of someone's neck, you don't cut their jugular because that would just drool. If you cut their carotid artery, which is the red one here, that's where you'd see blood kind of shooting out. Okay? It seems kind of, creepy, but just to let you know, the venous side, much lower pressure. So when you see that in movies, you know that they're not being accurate. The jugular sounds more interesting than the carotid. Okay, let's see, more blood vessels here. Anything blue in here, in the lungs, is going to be what? Artery or vein?
Artery.
Artery, right? Remember, blue, anything having to do with lungs or pulmonary. So if I point to anything red in here, pulmonary veins. Anything blue, pulmonary arteries, right? Everything's switched when you have the word pulmonary associated with it. Okay, can you guys remember that? All right, moving on. We're going to eventually get to the esophagus, but not yet. I'll come back to it. Over here, this blood vessel here, under the clavicle. So the suffix for clavicle is clavian. So it becomes the subclavian vein and artery. So subclavian means right under the clavicle. So clavicle, clavian, right? So subclavian, and it helps you. Then eventually you're going to get down to the brachial, radial, ulnar, right? It kind of makes sense. Moving downwards. All right, this is here the abdominal aorta and still the inferior vena cava. Believe it or not, the inferior vena cava doesn't change names from the pelvis all the way up. So it stays inferior vena cava. Blood vessels going out to the kidneys are called renal, artery, and vein. Colors are very straightforward, right? If it's blue, renal artery, renal vein, anything in there, you're good to go. We haven't hit the renal system yet, and I'll be asking you more questions when we get to that, but that'll be for the final. For the main blood vessel thing, it's going to be just renal artery and vein, okay? And then I'm going to let you guys work on the blood vessels down here. That's from the model. All the blood vessels here and here are on the next test, so you need to know them, okay? And it is one of the, it's called torso model, and everything will be labeled. Now what you're going to see is a whole bunch of numbers, right? A whole bunch of numbers pointing out all kinds of structures in here. And then the next page is going to have them keyed, okay? So you need to know the blood vessels. That's going to be something I'm going to ask you to do, okay? So you're going to need to spend some time with that. Next, the medium heart. Basically, everything is exactly the same as the previous heart, right? But the nice thing about this particular one is it has a QR code so that if you're not sure, you can just get it from the model, okay? If you're having trouble with any of the QR codes, downloading the models or scanning or whatever, please let me know, because I need to know if you can't get these QR code models brought up in the app, okay? And then last but not least, this is the blood vessel arm. This also has a key on the S drive. Well, I'm going to ask you guys to be very careful with this because the little numbers on here can break off, and that would make it much more difficult for you to learn if the numbers were gone, okay? So find something that says blood vessels of the arm or arm blood vessel or something like that. You might even just do a search of the S drive for the word blood, and then especially in the keys to models and other, right? And you will find this. Now, I normally only ask the large blood vessels, but because I've taken out all the functions, any and all blood vessels here may be up for grabs, okay? Any and all of them, anything that's numbered. And don't even think about trying to pull off a number and say, it's not numbered, see? I know which ones are numbered and which ones aren't, so don't yank numbers off thinking that will get you out of learning it, okay? I believe that is it for heart and blood vessels, so good job.